presenting on behalf of my group, the effect of nurse burnout on patient safety compared to well-staffed hospitals. If you aren't familiar with burnout, it can be an emotional exhaustion, lack of motivation, or feelings of frustration, which is often displayed as seeing nurses that are very overwhelmed or overworked. Some causes of nurse burnout are low staffing and overwhelming work demands in the hospital setting, which puts patients and patient safety at risk. This led to our PCOT question of, in hospitals with short staff, what is the effect of nurse burnout on patient safety compared to well-staffed hospitals? In order to further examine this, we had to identify nurse burnout and its causes, as well as its effect on patients. And this is very important to consider, especially now in this time, because data shows that as of 2022, this year, 19% of hospitals across the United States are understaffed. In the last 2 years, hospitals across the country have experienced a major decline in the number of nurses available to work. In the hospital setting, this looks like overworked nurses, staffing shortages, high patient-to-nurse ratios, and nurses generally feeling overwhelmed, which can lead to burnout. The medical surgical unit is experiencing high levels of this stress, and it's also experiencing a staffing shortage, which is causing nurses to feel even more overwhelmed and overworked at work. When nurses are presented with these feelings, it can lead to burnout over time. And this leads us to the biggest question of all is, are patients safe in these conditions? Patient safety is obviously the number one most important thing in the hospital setting. And in areas with high rates of burnout, it can lead, unfortunately, to patients injuring themselves due to a fall or just general lack of engagement from the staff due to staffing or burnout. And with this in mind, patient safety being a nurse's top priority, we have to consider the role of high workloads and lack of staff and how burnout can affect how a nurse perceives their patient safety. So again, our PCOT question is, in hospitals with short staff, what is the effect of nurse burnout on patient safety compared to well-staffed hospitals? In order to examine this question, we used an intervention template, which allows us and researchers to focus on the effects of nurse burnout as the primary variable of interest. This comparison will ultimately aid in the examination of how nurse burnout affects the patient safety and identify how staffing ratios can make an impact on both the variable of interest and the outcome. In order to find these articles, we used Google search engines like Google Scholar, as well as the Goldfarb School of Nursing Library. Collectively, we used keywords in our research such as nurse burnout, understaffed, patient safety, staffing ratios, nurse faculty, chronic stress, overworked, work and life balance, high overloads, and quality of care. The major themes in these studies analyzed were that patient safety and nurse burnout, all of which found a negative correlation between burnout and patient safety. Throughout these articles, we used research articles and a systemic review. And all of these led and supported our PCOT question. For the review of literature, the studies evaluated by this group overarchingly found a negative correlation between nurse burnout and patient safety. Again, nurse burnout is the result of a heavy workload and short staffing in the hospital setting, which can contribute to decreased patient safety. Throughout these 7 articles, it suggests that nursing burnout does negatively affect patient safety in hospitals with short staff. One of the first articles we found, written by Shah and colleagues, used survey data of 50,000 nurses across the United States and showed that the primary cause of nurse burnout was poor staffing ratios. This was important to establish in order to further address our PCOT question. Also, the Western Journal of Nursing Research found that nurses that scored lower on the Maslach burnout inventory scored higher on the patient culture survey, indicating that burnout does negatively affect patient safety. This article was written in 2008, but it is still relevant, especially with the COVID-19 pandemic, and it sets the foundation for this topic. Another article by Ryu and Shim found that institutions with higher numbers of nurses experiencing burnout, there are lower patient safety management activities. Ryu and Shim also suggest that in order to address this, we need to enhance compassion in the hospital setting, as well as focus on both group and individual efforts to fight burnout. Another article based in China examined over 1,500 nurses across 23 hospitals. It was actually one of the first studies to examine this topic in this grade of detail. And it found that lower workloads and better environments are associated with patient safety. In other words, uncompleted nursing care activities and burnout are negatively associated with patient safety. So essentially in hospitals where there is not a lot of burnout, there's good staffing, there's good workloads, patient safety is doing well. Equally, in hospitals with higher prevalence of nurse burnout, not enough staff, patients are not as safe. It was also found in a study in 2016 that there's a positive safety culture associated with a low score for burnout and a strong sense of coherence. They also mention how there's a lack of attention when there is burnout present in the hospital, which can lead to decreased patient safety. And it notes how burnout develops over time, and it is important to manage that stress in order to prevent burnout from getting to the point where it is negatively affecting patient safety. Furthermore, in a cross-sectional study of 117 nurses, it was found that high levels of burnout met with a low grade of patient safety, overall perception of safety, increased frequency of adverse events, and medication errors. Obviously, all of these factors can negatively affect patient safety, especially medication errors. If a patient was given the wrong medication due to a nurse being overwhelmed or overworked, that would be a great safety violation. For nursing practice implications, based on what we've learned from how burnout affects patient safety based on staffing, we found that the review of the literature shows inadequate staffing and nurse burnout are negatively associated with patient safety, which supports our hypothesis. Considering the paramount importance of patient safety, organizations should consider taking the following steps. Mandate safe nurse-to-patient ratios, reduce stigma by recognizing the effects of burnout, appoint a wellness officer to focus on the well-being of clinicians, show their commitment to addressing nurse burnout by offering mental health and self-care resources to their employees, and incorporate team-based interventions such as social support network, debriefing, and group stress management sessions. Collectively, these interventions could prevent burnout or give nurses experiencing burnout a way to cope with those feelings in order to prevent them from getting to the point where it is negatively affecting patient safety, as well as some larger hospital-wide interventions that could prevent burnout in the first place. Furthermore, there is a need for increased conceptual clarity and rigor in the studies examining nurse burnout and patient safety. The current literature is primarily based on cross-sectional studies without a clear theoretical approach, and measures for burnout are often inconsistent. To fully understand the relationship between nurse burnout and patient safety, studies using longitudinal data and a validated and reliable standardized measurement for burnout are needed. And hopefully we will see those studies come into play within the next few years. So overall, it is just important to remember that burnout can affect any and all nurses across the country, across the world, and it is dangerous for patient safety when nurses are experiencing burnout at especially the high volumes we are seeing today. Overall, improving staffing ratios can help prevent poor patient safety outcomes. And that relates back to our PCOT question. It does appear that in hospitals with short staff, nursing burnout does have a negative impact on patient safety when compared to well-staffed hospitals. So we hope that you found this interesting, and we look forward to hearing your comments on our video. Thank you for listening.